Hello, today we'll discuss an abnormal psychological disorder that has to do with spoken communication. It's called expressive language disorder. Expressive language disorder occurs when an individual has trouble expressing him or herself with spoken language, and it has two subcategories, developmental type and acquired type. Developmental expressive language disorder does not currently have a known cause and typically appears in childhood while the child is learning to talk. Acquired expressive language disorder is caused by brain damage, for example, a traumatic head injury, a stroke, or seizures. This type of expressive language disorder can appear at any time. So how can you tell if someone has a disorder? In developmental expressive language disorder, the symptoms can vary from child to child. Typically, children with a disorder do not have trouble with pronunciation of words. However, they do have trouble putting sentences together coherently, recalling the right word to use, and other similar problems. Children with a disorder also have problems communicating wants, thoughts, or needs at the same level of complexity as their peers, and their vocabulary is limited. These symptoms also apply to people with the acquired type. However, though people with this disorder cannot express themselves well, they are perfectly able to understand their peers, as well as detailed, coherent sentences that they themselves cannot form. So don't ever assume that just because someone can't talk, they can't understand either. The treatment for this disorder is usually seeing a speech therapist in order to do one-on-one work with communication skills that the child needs in everyday life. In general, this treatment works well, and the prognosis of developmental expressive language disorder is good, since most children with the disorder develop normal or nearly normal communication skills by high school. In addition, in acquired expressive language disorder, the amount of recovery depends on the nature and the location of the brain injury. While some people gain their speech functionality back in months, others take years and still some never recover. Since acquired expressive language disorder is caused by brain injury, simple prevention methods such as wearing a helmet when riding a bicycle and lowering cholesterol in order to help prevent strokes can stave off the disorder. Just be smart and your brain will thank you.